for a message that's very important. So I want to introduce our Jefferson County Judge Jeff Brannick, who will be followed by Jesus Abrego.
Well, good afternoon. Thank y'all so very much for being here today. I appreciate it. I'm here today and joined by Jesus Abrego, with the Diocese of Southeast Texas, as well as Dr. Edie, our County Health Authority. And we're here about a matter of concern that we want to bring to the attention of the public and try to get as much buy-in from the members of the public into getting vaccinations as is possible right now. When I look at the Department of State Health Services numbers for vaccinations in Jefferson County, it appears, and I say appears for a reason I'll tell you in a minute, that African American and Hispanic vaccinations are under the percentage that they should be given our percentages within the county. And I say appear to be because about 22% of the individuals that are reported on the State Health Services website declined to give their ethnicity. So we're having a problem getting good, accurate numbers. But we did want to be here today, and we want to make an appeal, particularly to those over the age of 65, those who are Hispanic or African American, to please go to vaccine.beaumonttexas.gov or call area code 409-550-2536 and register to get your vaccine. We want everyone who is desirous of getting the vaccine to have the opportunity to get it, and we want to make sure that every member of our community, regardless of ethnicity, has the opportunity and access to the vaccine and to other health care. So I would greatly appreciate the news media getting that message out, and I'd like to invite Mr. Abrego up here to speak and to join us in urging members of the community to register and to get the vaccine. Mr. Abrego?
Thank you, Judge. Voy a hablar de la importancia de la vacuna. En nuestro condado, los latinos somos aproximadamente el 20% de la población y muy pocos de nosotros nos hemos vacunado, y el condado está pidiéndonos a los latinos que por favor nos registremos para que recibamos el beneficio de ser vacunados. Su estatus migratorio no tiene absolutamente nada que ver. Usted llama o se registra por internet y no tiene que presentar su número de seguro social. Entonces, bien importante que nos vacunemos. Un servidor ya cumplió las 2 semanas después de la segunda dosis y toda mi familia nos hemos podido vacunar. Entonces, bien importante que nos protejamos y protejamos a nuestras familias. Hay un montón de cosas que se dicen sobre la vacuna, pero si usted se pone a leer a los expertos, se da cuenta que la vacuna realmente está ayudando en nuestra lucha en contra de este tremendo virus que nos ha cambiado la manera de vivir. I basically invited the Spanish-speaking community of Southeast Texas to get the vaccine. It's important for us, just like everybody else, to get vaccinated. So that's the reason I'm here. Thank you.
Thank you so much. Dr. Edie, would you like to say anything? Well, thank you for being here today, and thank you to the members of the media. We are getting sufficient numbers. I just, before walking down here, looked at the latest numbers that Ms. Getz sent me from our partners here in the Southeast Texas Regional Coalition for administration of the vaccines throughout our 5-county area, and everybody is doing well. Out of the 11,500 doses that Port Arthur and Beaumont have received thus far, they have gotten out almost all of them. Likewise, they're doing well in Orange, Hardin, Jasper, and Newton counties, and our private healthcare partners are also doing well in administering the viruses, and we're getting those on a fairly frequent basis. Just allotted some more out yesterday that were received. I will tell you, because I've received several calls about the Johnson & Johnson vaccine, that I got word this morning that as of yet, Texas is not receiving any of the Johnson & Johnson one-dose vaccine, but we will continue to get the Moderna and possibly the Pfizer vaccines, which are 2-dose administrations. But again, that number is 409-550-2536 to register for the vaccine, or vaccine.beaumonttexas.gov. And please do your part to get vaccinated to help our community as we seek herd immunity from the COVID-19 novel coronavirus. And we appreciate you being here today. Thank you so much.
Guys, I have a question. What effort has the county made in order to reach those minority communities and trying to get them to get vaccinated?
Well, number one, the Beaumont Public Health Department and the Port Arthur Public Health Departments are the main sources for administration of the vaccines locally, and those are located in primarily ethnic neighborhoods. All of the notices that we've been putting out through the media have been directed to all segments of our population. And of course, the purpose of our having this today is, as we look at the numbers, and again, I'm going to say it appears that we have an underutilization of the vaccine administration amongst ethnic minorities, and probably true even though we have 22% unaccounted for in the numbers. But we just want people to know that regardless of immigration status or whatever, we want every member of our community that wants the vaccine to get the vaccine.
Today's a big day for the state of Texas. Businesses can operate at 100%. The mask mandate got restored. What are your overall thoughts on that?
Say that again, George.
Businesses can operate at 100% and the statewide mask mandate was rescinded. What are your overall thoughts on that order going into effect today?
You know, the orders are what the orders are from the state level, and I sort of uphold the Constitution and laws of the state of Texas, and that's one of the laws of the state of Texas, and one that I'll uphold. However, at the county offices and all county buildings, as well as the courthouse, sub-courthouse, and all of our county buildings, the COVID protocols will remain in place at least until March 30th. We want to get through the spring break holidays, because as you know, during every other holiday season that we've had over the last year, we have an increase in the number of new infections, and we want to see whether or not there's a spike after this. In addition, we want to see continued administration of the doses of the vaccine that help us to reach herd immunity. The numbers are looking great across the state of Texas. ICU admittances are down, hospitalizations are down, new infections are down, and there have been some pretty impressive numbers, but we're going to maintain some caution here at Jefferson County. I know that some of the surrounding counties are just encouraging it, but Jefferson County is going to require masks from patrons and employees within the Jefferson County office buildings through at least March 30th. And if people are uncomfortable with that, if they've had both doses of the administration of the vaccine, they are welcome to come in without a mask. But if they have not, then they're going to be required to wear a mask. Otherwise, they'll need to conduct their business either online or through the mail.
We've seen some cities across the state keep their mask mandate in place despite Governor Abbott's new orders going into effect. Did the county consider bringing back the mask mandate?
There's no provision under Chapter 418 of the Government Code at this time that would allow me to overrule the governor's orders. Yes, there is. Commissioner Alfred has this last week and a half been scheduling the Mobile Medical Health Unit. Our Emergency Operations Center is dispensing some additional doses of vaccine to the Mobile Medical Unit. They have a schedule that's out there. I believe it's on the Public Health website of where they're going to be. We're also going to be having some conversations at the end of this week or the first part of this next week about specific targeted areas, while we're also having conversations about how to best administer the vaccine to our correctional facility inmates so that we can not only protect them but protect our correctional workers.
As we know, holidays result in increases of COVID cases, just people testing positive for COVID. What are any concerns that you have, just going forward as we are going into this?
It's always the same: large gatherings without appropriate hygiene or safety protocols or social distancing. I mean, there's typically we'll see what impact the vaccines that have been given so far have had on further spread of the virus. I'm hoping that we continue to see a decline. Normally every evening when I get Dr. Joshi's epidemiological reports, I forward those on to the news media. They show that we're back down below September levels, but the last couple of days we've seen a little bit of a increase in the number of cases, and we want to continue to see a downward trend in those numbers, and so we're going to continue to watch it very carefully.
Here in recent weeks, we've heard about a lot of people coming from different parts of the state to the area to receive vaccines, because several health departments have relaxed their restrictions. Are you concerned that Southeast Texans may not be able to receive vaccines because so many people are coming here to get a vaccine?
Well, I think during the early parts of the process, whenever the pharmacies were getting the vaccine, before the counties and the hub was getting the vaccine, we were seeing a number of Jefferson County residents going to Chambers County and to Jasper County to go to the pharmacies up there to get the vaccine. And we may see some individuals from outside the county that come here to get the vaccine. The state has made it clear that they don't want us checking to see where people live when they register for the vaccine. We just are meant to administer it to as many Texans as we can. We want to target those populations that are underserved or appear to lack access. But I think over the next several weeks, we're going to see even larger influx of vaccines available to us as Johnson & Johnson vaccine comes on the market, and as yet not distributed to Texas, but it's distributed to other states. That Moderna and Pfizer vaccine should become more available to Texas. So we should see an increase in the number of doses available to us. So I don't really anticipate there being a problem. We just want to make sure we have enough people to administer the vaccine to if they desire to get it.
With more vaccines becoming available and our numbers trending down, Texas opening 100% today, is the message to the public still not to let their guard down?
Well, I think over the last several weeks, what I've witnessed is I went to some retail establishment, and it appeared to me that they were already open 100%. And I look at most people still wearing masks at the grocery stores, and I think we'll still have a pretty good percentage of individuals that are going to do it voluntarily until we get a little bit further down on the moving average new infection curve. So I think things are moving in the right direction. I just want to wait and see what impact spring break has on the numbers. At what point
do you see yourself potentially making a similar recommendation?
I think there have been some instances where individuals that weren't in the 1A and 1B categories have received vaccines because some of the doses some of the Pfizer and Moderna may come 6 to a vial, some 10 to a vial, and at the end of the day they've had doses left over with no one within those categories to receive them, so they've given those doses so that they wouldn't go bad to individuals that were in another category. So long as we're getting people vaccinated and for every individual that we get vaccinated, regardless of what group they're in, that lessens the extent of the spread amongst all our citizens that they have interaction with. So I'm happy to see that, but we want to focus right now on those who are most vulnerable to hospitalizations and significant health issues. And so we want to particularly focus on our over 65 population, our people with underlying health conditions, and underserved communities like Hispanics and African Americans. The Asian community appears to be very well served across the state by the number of vaccinations they're getting. All right, well, thank you all so much for being here today, and thank you to Mr. Abrego and Dr. Edie for being here. I appreciate it.